Hi, I'm Dr. Cosgrove.
I'm Dr. Ryan.
And we are Formby GP. So I'm here with Dr. Ryan, Heather, my wife, today to congratulate her on having been elected to the UK Council of the Royal College of General Practitioners. Well done, Heather.
Thank you. I'm absolutely chuffed and quite surprised. Thank you.
Fantastic. So what does that actually mean?
Well, so the Royal College of GPs is the professional body for UK general practice, and the remit of the RCGP is to set professional standards and clinical standards, and to support doctors and GPs in training with education and so forth.
That sounds like a big job.
Absolutely.
So, Royal College of GPs has been around since the 50s, and it currently has about 54,000 members worldwide, mainly in the UK. And those members are represented by the council, which is about 70 strong, 74 members I think. Of those 74, 18 are elected directly, as you just have been, Heather. And of those 18, each year 6 are re-elected. And this year there were 13 candidates, all very strong, excellent GPs who stood for election. So well done, Heather, you did very well.
Thank you. As I say, I was very surprised and really, really honoured. It's a tremendous honour to be chosen.
Fantastic. So, what do you think you might achieve on council, Heather?
Well, so council, the remit of council is to essentially set the strategic and policy direction of the college. And when I ran for election, I suppose there were 3 main planks to my manifesto. The first one was talking about evidence-based care and the risk of overdiagnosis. And this is something you'll have seen us talk about on our social media, on our Facebook page. Essentially, as medicine has advanced, we can now do more tests and offer more treatments than ever before. And actually, there's something of a risk that if you go looking for trouble, you tend to find it. And if you investigate too much, there's a real risk that you find, minor abnormalities that don't need treatment and would never have harmed you or killed you. And obviously that creates work for GPs, within the NHS, and it creates stress and anxiety for patients. If you have a test and you're told that something's abnormal, you may need it investigating further, you may go away and worry about it. So I think we need to be very careful that we only do tests that are really going to add to patients' care, and that we only offer medicines and treatments that are going to have real benefit, that are going to make people feel better and or extend their life. Now, the second thing that I talked about was GP workload, and I guess this is more relevant to the NHS. Both John and I still do some NHS work. Now, at the moment, UK general practice is stretched more thinly than ever, and unfortunately, GPs are really struggling to be able to offer decent access and decent continuity of care, because there just aren't enough doctors, there's not enough resource, not enough funding. And I think that the workload crisis, really defines so much of what GPs can do. And it's really important. Obviously, the Royal College of GPs, because it sets professional standards and policy, there's often workload implications. If the RCGP says that all GPs should be doing X, Y, Z, where do you get the time to do that if you're already stretched so thinly? So that's why I believe that council needs to be very mindful of workload implications when it's setting policy. The third thing that I talked about in my manifesto was private practice, and how RCGP should be a membership organisation for all GPs, both those working in the NHS, but also those like us that do some private work. And increasingly, doctors are working both in the NHS and privately, not just in small practices like ours, but there's also digital providers and so forth. So lots of doctors have some involvement with the private sector, and it's really important that doctors working in the private sector don't become professionally isolated, and that they have access to education and CPD and professional support, and that they understand that, you know, all the really high quality resources and policies that RCGP puts out about things like testing, treatment, overdiagnosis, that they understand that you know, is there for their use, and that, you know, they have that professional support. So those are the three. The other thing I talked about actually, which is again sort of relevant to Formby GP and sort of not, I talked a bit about you know, staffing within you know, UK general practice. In NHS surgeries, we're seeing that due to the workload and workforce crisis, you know, a lot of practices are having to use allied health professionals, and in particular, you know, roles like physicians associates that are quite new. And again, I talked about how actually, you know, GPs in the UK get tremendous training, you know, 5 or 6 years of medical school normally, and then, you know, several years of postgraduate training. And so I think GPs are best placed to see patients with undifferentiated presentations. And I find here at Formby GP, patients often come to see me and they think that one thing is wrong with them, and actually it turns out to be something else altogether. And I think that GP training really prepares us to actually work out what's going on and get to the bottom of patient symptoms. So I think it's really important that additional roles and additional healthcare roles are very clearly defined, and that there's not too much scope creep. And, you know, my personal view is that, you know, GPs are the best people to see patients who, you know, haven't seen anyone before and have a problem that needs solving.
That's a big agenda.
It is, yeah.
But all really important, all really topical. So, just to spell it out, I think you've explained this already, Hannah. But if you succeed to any degree with that agenda, I mean, what impact do you think that could have on general practice in the UK, whether at NHS or private?
Thank you. So I think the overdiagnosis thing, you know, as I say, I think you've probably all heard us talk about this before. I think it's so important as doctors, we have such a responsibility to ensure that patients are getting good care, and you know, and that we're not offering tests and treatments that are going to do more harm than good. So I think it's really that's a really important thing that I believe in. I think also, you know, the workload issue. You know, ultimately at the moment, NHS general practice is really struggling, and we need to find solutions to the workload and workforce crisis, and we need to try and take the strain off GPs to an extent, because ultimately, you know, a lot of patients come to us here at Formby GP because they're struggling to access their NHS GP, and it's not because NHS GPs are all off, you know, playing golf. It's because there aren't enough doctors, and you know, UK general practice is under tremendous strain. And I think that those two elements tie together. That obviously, you know, I've talked about overdiagnosis. If we make sure that we're offering high quality care and offering tests and treatments of high value, and we strip away some of the unnecessary things of limited benefit, that obviously does free up doctors' time a bit.
That's sorely needed. Absolutely.
Yeah.
Well, let's fingers crossed with that.
Yeah.
So, Heather, coming back to Formby, now that you've been elected to this lofty position, what does that mean for us here in Formby GP? Does that mean that our patients will see less of you, or?
No, not at all. So actually, RCGP Council meets 4 times a year, and meetings are on a Friday or a Saturday. I don't work here on a Friday or a Saturday, so on a practical level, I shouldn't be here any less. And in terms of what it means for patients, I mean, hopefully, you know, if we can get these important topics on the agenda, and if we can ensure that private GPs get, you know, good professional support and professional training in CPD and so forth, you know, I think it can only be a benefit to private doctors and their patients.
Absolutely. Well, best of luck with that, Heather, and do please update our patients and let us all know how you get on.
I will, thank you.
So thank you for watching our first video. I hope you found it interesting. If so, please hit the like button to let us know we're on the right track and we're creating content that you find entertaining and interesting. If you want to share your perspective, please add a comment down below in the comments section. We know that, you know, these topics can generate a lot of emotion, a lot of different opinions. So please share them below. and please subscribe to our YouTube channel so you don't miss the next update. Many thanks.